Hello, my name is Dr. Dewan S. Raja. Today I'll solve multiple choice questions in abdominal anatomy from question number 11 to question number 20. I will put all the answers as well as the recommended book links in the description of my video for your kind information. Let us solve the multiple choice questions. Question number 11. Taeniae coli are three segregation of longitudinal muscles in the wall of what? Esophagus, stomach, duodenum, cecum, anal canal. So Taeniae coli are the segregation of longitudinal muscle in the wall of the intestine, the large intestine, and these are thickening of the longitudinal muscle. So it is not present in the esophagus, not in the stomach, not in the duodenum, not in the anal canal. It begins from the base of the appendix, the pernicious appendix. It is present in the cecum, ascending colon, transverse colon, descending colon, up to the sigmoid colon. Okay, so these are not present in esophagus, stomach, duodenum, anal canal. Answer should be cecum. Here we'll get the Taeniae coli. We have three Taeniae coli. These are the thickening of the longitudinal muscle in the wall of the large intestine. Okay, let's go question number 12. The left ovarian vein is a tributary of what? Inferior vena cava, left renal vein, left common iliac vein, left internal iliac vein. Answer should be left renal vein. Okay. The major somatic nerve of the perineum is the pudendal nerve. This nerve originates from which of the following spinal cord segment? Our nerve is the pudendal nerve. Does it come from L1 and L2, L3, L4, L5 and S1, S2, S3, S4? What is the answer? Answer should be S2, S3, S4. So these are the root value for the pudendal nerve. It is getting contribution from these segments of the spinal cord, S2, S3 and S4. What is the homologous structure of prostatic utricle in female? Fallopian tube, ovary, greater vestibular gland, uterus. What is the correct answer? Homologous structure of prostatic utricle in female. Answer should be uterus. Which of the following nerve leaves the pelvic cavity through the greater sciatic foramen, then immediately enters the perineum inferiorly to the pelvic floor by passing around the ischial spine and through the lesser sciatic foramen? What is the answer? Femoral nerve, genitofemoral nerve, ilioinguinal nerve, pudendal nerve, sciatic nerve. What is the answer? Answer should be pudendal nerve. Okay. Then, which of the following foramen or canal is bounded by the sacrospinous ligament, pelvic bone, sacrotuberous ligament, and it contains the tendon of the obturator internus muscle and the pudendal nerve? Okay, so which foramen or canal? Greater sciatic foramen, lesser sciatic foramen, obturator canal, femoral canal. So it should be the lesser sciatic foramen. Okay, so it contains the tendon of the obturator internus, pudendal nerve, okay, bounded by sacrospinous pelvic bonus sacrotuberous ligament. Answer should be lesser sciatic foramen. Lesser sciatic foramen. Which of the following structure passes through the greater sciatic foramen above the piriformis muscle? Sciatic nerve, superior gluteal nerve, posterior femoral cutaneous nerve, nerve to the quadratus femoris, internal pudendal vessels. What is the answer? Answer should be superior gluteal nerve. Okay, here, which of the following part of the gastrointestinal system is continuous above with the sigmoid colon at the level of the vertebra S3? What is that structure that unites with the sigmoid, that continues? It is continuity with that of the sigmoid colon at the level of sacral vertebra 3. Is it anal canal, rectum, descending colon, vermiform appendix? Answer should be rectum, B. Which of the following structure is crossed by the ureter at the pelvic inlet as it enters the pelvic cavity? Okay, structure crossed by the ureter, abdominal aorta, termination of common iliac artery, inferior vena cava, inferior epigastric artery. What is the correct answer? At the pelvic brim, there will be crossing with the ureter. Where? What is this? There should be termination of the common iliac artery and it's splitting into internal and external iliac artery. So this termination is crossed by the ureter. Which of the following tributaries, question number 20, which of the following tributaries of the splenic vein drain venous blood from the fundus of the stomach? Which of the following tributaries? Short gastric vein, inferior mesenteric vein, pancreatic vein, left gastroepiploic vein, also called left gastroomental vein. Okay, what is the answer? Tributaries of the splenic vein that drain blood from the fundus of the stomach. Answer should be short gastric veins. That is associated with the fundus. Short gastric veins. Okay, and that's all about the multiple choice questions from question number 11 to 20. If you have any question, please feel free to ask me. Please share the information with your friends, and what you need to do, and please support my channel. Please subscribe me. Any question, please feel free to ask me, and I will put all the answer keys and the reference book links in the description segment of my YouTube video. So that is for your kind information. So have a nice day. Bye now.